Hi, and welcome to the first edition of Warehouse Wednesdays. I'm Tim Ra from Precise Medical Supplies, and today we're going to be chatting about post-mastectomy fat transfer and the equipment that we recommend for using for this procedure. Of course, I'm only a salesman, so I've never done a fat transfer procedure, but I do often get asked to suggest equipment. This procedure should only be performed by qualified professionals, and these are only my equipment suggestions. So, what is post-mastectomy fat transfer, and why would you want to do this? The breast tissue becomes degraded and friable post-radiation therapy, and it has been found that injecting fat to this compromised tissue helps to restore plasticity and viability. And then, in many cases, if required, a tissue expander and subsequently a prosthesis may be implanted. There are just two steps to the procedure: harvesting and then re-injecting. Now, let's get into the equipment we recommend for doing this procedure. First, to prepare the tissue for harvesting, in most cases you want to tumesce the area with Lammis fluid. You can use a spinal needle for this, but we recommend using the single-use Lammis infusion needle, sometimes called garden spray needle. These are available in various gauges and length. I've got a 14 gauge by 15 centimeter here. They feature 10 holes arranged circumferentially that allows rapid and even distribution of fluid. Now you're ready to harvest the fat. The cannulas that we recommend using are either a single-use 24-hole, 3 mm by 15 cm with a lower lock connection, or a single-use 4-hole, 3 mm by 15 cm cannula. The 24-hole cannula yields very small particles of fat, ideal for re-injecting, whilst the 4-hole is a more aggressive cannula and is used for those patients who have less accessible fat. So, attach your harvesting cannula to any lower lock syringe. We have a 10 cc syringe here, but you can use a 60 cc syringe. In fact, any volume will do as long as it's a lower lock syringe. Insert it into the patient and pull back the plunger. To help you maintain the negative pressure, use a single-use snapper and begin harvesting. Now, to use the snapper, you place it into the plunger of the 10 cc syringe like that, close that up, insert it into the patient, and when you pull it back, it'll just click out like that, and that'll hold that plunger back and makes the harvesting procedure a whole lot easier. Now you have your syringes filled with fat. Allow them to rest for several minutes so that the fat separates out from the oil and the fluid, which should be removed prior to re-injecting the fat. You can expect to get about half re-injectable fat in each syringe and 50% material that you want to discard. If you harvested the tissue using a 10 cc syringe, you can probably just use that to re-inject into the area to be treated. If, however, you used a larger syringe, such as a 60 cc, you'll need to transfer the fat to a smaller syringe, such as a 10, 3, or even 1 cc syringe for re-injecting. And you can use a lower lock connector for that, a lower lock to lower lock connector for that. So what you do is you just attach that to your syringe filled with fat, to your cannula that you're going to use for re-injecting. Say, in this case, the 10 cc syringe. So you just connect the two like that, and then you can easily transfer the fat from one syringe to the other until your smaller syringe is filled with fat and ready to re-inject. Finally, attach the one-hole Coleman-style re-injecting cannula that you will use to re-inject that fat. Attach that to your syringe that is now filled with fat and implant the fat into the area to be treated. Okay, thanks for watching. If you're looking for equipment, simply visit the link in the video description below to visit a blog post with links to the relevant products. See you next time. Bye.